Hey everyone. I had to do a documentary today, or actually I participated in a documentary today for the Tubi network called Famously Haunted. And I had to put my uniform back on, so I figured, well, I've got my colors on. I will start the next video, this intro, the next video. And it is about the death of Matthew Perry. Now, I'm going to go into his autopsy a little bit. It's quite complicated. I'll spare you a lot of that. But what I'm going to read for you right now is the witness statements. This is the part that's probably the easiest to understand, because this is how, the law enforcement got involved. It's how the first responders showed up and how the whole situation unfolded. So I'll read this document to you. And it says, according to detectives at the scene, which is case number 2023-14789, that's Matthew Langford Perry. According to detectives at the scene, all information provided was preliminary. The LAPD robbery homicide investigation will be ongoing. On October 28th, 2023, at 11 a.m., the decedent, Matthew Perry, had played pickleball. At 1:37 p.m., he was last known alive by his personal live-in assistant, who left the residence to run errands at about 1:37 p.m. At 4 p.m., the assistant returned home and found the decedent floating face down at the heated end of the pool, the hot tub or the jacuzzi. The assistant jumped into the pool, moved the decedent into the sitting position on the steps, and called 911. Los Angeles Fire Department rescue ambulance and engine number 23 responded. They pulled the decedent out of the pool onto the grass, and he was pronounced at 2:17 p.m. The door notices, meaning when you have a keypad entrance to your house, it's all electronics. They can monitor it, so you can tell when people come in and out, and that would be the door notice. And they are consistent with the times that the assistant provided of leaving and arriving back at the residence. And the resident alarm had not been triggered at any other time. The password protective drive for the video, there'd be the monitoring cameras that were all over the property, that was pulled, and they believed there might not be any, not have been activated at the time of the incident, of course, because it's a motion detector, and he was sitting probably on his own, and it only really records serious motion, not subtle motion. The assistant did not report any recent illnesses, complaints, drinking, or drug abuse. The decedent, Matthew Perry's assistant, provided him with a list of all the medications. Many had been stopped, however. The decedent was currently taking Subutex twice a day. Is an FDA-approved drug that can be used to treat those dealing with an opioid use disorder. In some cases, it may be prescribed as a painkiller. The assistant was responsible for administering the medication, as I understand it. There was like a sober friend, someone who was monitoring him, keeping him company, and discouraging him from using because he had problems with substance abuse. Matthew Perry was seeing a psychiatrist and was prescribed antidepressants. The decedent's current primary care physician was an anesthesiologist, and they have found no apparent illicit drugs, drug paraphernalia, or alcohol, only nicotine vape products. Per the assistant, the decedent was currently smoking 2 packs of cigarettes a day, and he had a medical history of chronic obstructive pulmonary disease and emphysema. Chronic obstructive pulmonary disease, COPD, is a common lung disease causing restricted airflow and breathing problems. It's sometimes called emphysema or chronic bronchitis. In people with COPD, the lungs can get damaged or clogged with phlegm. Symptoms include cough, sometimes with phlegm, difficulty breathing, wheezing, and tiredness. Smoking and air pollution are the most common causes of COPD. People with COPD are at higher risk of other health problems. It's not curable, but symptoms can improve if one avoids smoking and exposure to air pollution and gets vaccines to prevent infections. It can also be treated with medicines, oxygen, and pulmonary rehabilitation. The decedent had a contact in his right eye from a surgery. The detective says, I can only say it's a female. via telephone, and in essence, she revealed the following information. She last spoke to Matthew Perry a few days ago, and she said he was in good spirits. The decedent had a medical history of emphysema, diabetes, depression, and anxiety. He had a prior history of depression, but had told her he would, quote, never kill himself. To her knowledge, the decedent had never made suicidal statements and had no known prior suicide attempts. He was taking ketamine treatments, which is, that's been a lot of press about the ketamine treatments, but it's used in for therapy for depression. It's not solely a recreational thing, or K, or what do they call it, special K or something like that, which is known to, it's a hallucinogenic, but it is also used in treatment for depression. His last doctor was treating him more frequently, and he was having treatments every other day. But his new doctor of 6 months stated that since he was in a good mood, his depression was fine, and he did not need more treatments. His most recent known treatment was a week and a half ago. The decedent had been sober for 19 months, aside from the treatments for depression, with no known relapse. He was taking 30 milligrams of Subutex and was hoping to be weaned down. To her knowledge, he had just stopped smoking 2 weeks ago, smoking physically, but probably still taking doing the vapes. He was also prescribed a weight loss drug and was also getting testosterone shots, which he believes were causing him to be angry and mean for at least a couple of weeks. The detective says, during my scene investigation, no alcohol, illicit drugs, or drug paraphernalia were found. In the assistant's bedroom, there were multiple open, empty, half-filled medication bottles prescribed to the decedent, Matthew Perry, as well as over-the-counter medications, vitamins, digestive aids, and dishes filled with multiple various loose pills, tablets, caplets, candy, and breath mints. In the living room, there were multiple nicotine vaping products and an inhaler. In the refrigerator, there was tirazepam injectables and nicotine lollipops, the weight loss drugs and nicotine lollipops. There was used ashtrays throughout the residence. In the decedent's bathroom, there were various prescribed ointments, digestive aids, and oral rinses. The detective says, I left the Forensic Science Center at 21:56 hours and arrived at the scene at 22:32 hours. The scene was located in the backyard of a residence on the south side of Blue Sail Drive, west of South Surfview Drive. There was a gravel path on the east side of the property to the backyard of the residence, which contained a pool and a covered patio section along the residence and alongside the west side of the property. There were steps on the west side of the pool into the pool area with a raised divider between the pool and the heated section at the east end of the pool. The heated section had a step around it. There was glass between the pool and the covered patio sections near the residence, north of the heated end of the pool. The decedent was located lying supine in the grass area with his feet towards the pool and his head towards the residence. He said he left the scene at 1:05 a.m. and arrived back at the Forensic Science Center at 2:05 a.m. Now, this is the body examination. On October 29th at 1:35 a.m., he was brought from Blue Sail Drive and was brought to the Forensic Science Center. He was then processed into the facility at 2:05 a.m. by forensic attendant Alfred So-and-so. At the time of processing, the decedent was recorded a height of 70 inches and a weight of 216 pounds. The decedent is an adult Caucasian male who appears to be the reported 54 years of age, with short brown hair, blue eyes, beard and mustache, and natural teeth. He was clothed, lying supine on the ground. The decedent was wearing black underwear. Disposable electrocardiogram patches were in place, so that was a life-saving measure. They were trying to, they were actually monitoring his heart at that point, hoping to get him back, I suppose. Now, this is interesting. Insects were present. Insect bites. He had insect bites on his face. I'll go into that a little bit later on, but people thought, well, how long could he be been laying there when they pulled him out of the pool? I know that the law enforcement put a white tarp over him, a little tent, because there were helicopters, shooting video down there, and they do that now. It's pretty common practice for them to erect a little white portable tent over the remains of whomever was dead, just out of privacy respect. And people say, well, how long was he sitting there? Because he had bites, insect bites on his skin. But it's because, if ever we live in the desert, and there are the red ants out here. I forget what do they call them? Red ants.
Fire ants.
Fire ants. And all you have to do is step on the grass, and and within 2 seconds you'll see like 8 of them on your legs, and they bite tiny little things, not the big ones, tiny, and they bite hard, and it swells up. So these things are fast, and that's probably what was going on at that point. There was skin slip, an apparent fluid-filled blister on his back. There was a hard discoloration to the posterior right knee. There was yellow discoloration to the fingernail of the right pointer finger. There were minor contusions and abrasions throughout. He had a horizontal scar tissue on his right abdomen and irregular scar tissue on his midline shoulder girdle. The distal end of the right middle finger was amputated, healed. That's interesting. It says amputated and, in parenthesis, healed. He was warm to the touch. There was lividity showing on his back, and blanched to the light pressure. Rigor mortis was at a 4. He was identified by his driver's license, and per his stepmother, he was never married, had no children. His biological parents were alive, and is believed to be an advanced health care directive. At the time of this report, his advanced health care directive had not been reviewed or confirmed. So that just means your plans for what happens after you die. Who's the one that makes the medical decisions for you when you can't make decisions for yourself? And they're the legal representative to care for your remains, be them alive or dead. But I'll go into the details of the autopsy. Not too much, because I don't want to bore you to death, and I don't want to offend the people that get so bent out of shape when I mispronounce things, but I'll try my hardest. A quick shout out to Lisa McEwen for your help with this story. I really appreciate it. Without getting too technical, these are the results of the autopsy, or the actual examination. The body is identified by toe tags and is that of an unembalmed, refrigerated adult male who appears to be the reported age of 54. The body measures 70 inches, weighs 216 pounds, and is normally developed, mildly obese with a body mass index of 31. The nutritional status otherwise is unremarkable. Examination of the skin shows no evidence of jaundice. Mild immersion wrinkling of the hands and feet is noted. Early clubbing changes of the nail beds are noted. Yellowing of the right index nail is seen. The head is normal in size and shape. The scalp hair is gray-brown. There is no temporal or vertex balding. Mustache is present. Short goatee with facial stubble. Full beard is absent. There's no foam in the nostrils or oral cavity. Upper and lower teeth are present and in excellent dentition. There's no evidence of recent therapeutic intervention. Recent distinct needle punctures are not identified. There has not been postmortem intervention for organ procurement. So no organs were removed for donation. There's no evidence of fatal injury. The summary and opinion: Matthew Perry's cause of death is determined to be from the acute effects of ketamine. Contributory factors in his death include drowning, coronary artery disease, and buprenorphine, which is that Subutex drug that he took earlier for addiction. The manner of death is accident, drug, and drowning related. No signs of foul play are suspected in this death. At the high levels of ketamine found in this post-mortem blood specimens, the main lethal effects would be from both cardiovascular overstimulation and respiratory depression. Drowning contributes due to the likelihood of submersion into the pool as he lapsed into unconsciousness. Coronary artery disease contributes due to the exacerbation of ketamine-induced myocardial effects of the heart. Now, they describe ketamine as a dissociative anesthetic with established human medical and surgical uses. Also, it's used in recreational drug use and other illicit settings, mainly due to its dissociative nature, indicating disconnection of the mind and psychedelic effects. The latter effect explains its use in nightclub, party, rave culture. The exact method of intake in Mr. Perry's case is unknown. There were trace amounts of ketamine detected in his stomach contents. He was reported to be receiving ketamine infusion therapy for depression and anxiety. Per the medical examiner investigator's report, his last known treatment was 1.5 weeks prior to death, and the ketamine in his system at death would not be from that infusion therapy, since ketamine's half-life is 3 to 4 hours or less. So he was getting regular ketamine treatments for depression, and his last legitimate treatment was 1.5 weeks earlier, so he took it upon himself, it seems, to take ketamine and get into the hot tub, which was not a good idea. Bizarrely, a few days before he died, Matt made his final Instagram post. He's sitting in the very hot tub he would die in, staring out at the ocean. Oh, so warm water swirling around you makes you feel good? I'm Matt Man. You heard me.